Liver cirrhosis. Definition of liver cirrhosis. In cirrhosis of the liver, progressive scarring and fibrosis of the liver causes scar tissue to replace normal liver tissue, which alters the normal architectural structure of liver, which is characterized by scar, distorted, hardened, and lumpy liver surface with nodules. So, in liver cirrhosis, there is progressive scarring and fibrosis that causes scar tissue to replace with a normal liver tissue, and that is characterized by scar, distorted, hardened, and lumpy liver surface with nodules, as you can see in the image. So, this is the healthy liver, and as you can see below, there is cirrhosis of the liver image. Etiology and types of liver cirrhosis. Chronic alcoholism. The amount of alcohol intake is broken down and acts as a toxin, leading to inflammation, results in scarring of the liver tissue. So, chronic alcoholism leads to the scarring of the liver tissue. Autoimmune hepatitis. This disease appears to be the cause by the immune system and inflammatory response. So, it is also a major cause of liver cirrhosis. Inherited or genetic disorder. Bile duct obstruction. It happens due to blockage in the bile duct flow, which damages liver tissue. Bile duct obstruction is happened due to the blockage of the liver duct flow, which damages the liver tissue. Drug and toxin. Prolonged exposure to drugs and environmental toxins can lead to hepatic cell damage. So, chronic drugs and toxins can lead to the damage of the hepatic cell. Chronic hepatitis C. The hepatitis C virus is a liver inflammation that is spread by contact with an infected person's blood. Non-alcoholic fatty liver disease. In this, fat builds up in the liver and eventually causes cirrhosis. So, in non-alcoholic fatty liver disease, the fat builds up in the liver and eventually cause cirrhosis of the liver. Signs and symptoms of liver cirrhosis. Spider angiomata, vascular lesions consisting of the central arterioles surrounded by many small vessels. Palmar erythema, exaggeration of normal speckled mottling of palm. Nail changes, teres nails. Proximal to 3 of the nail plate appears white. Clubbing, angle between the nail plate and proximal nail folds less than 180 degree. Hypertrophic osteoarthropathy, chronic proliferative periostitis of the long bone that can cause considerable pain. Gynecomastia, hypogonadism, enlarged liver size, splenomegaly, ascites, jaundice, weight loss or sudden weight gain. Bruises, itchy skin, edema, a brownish or orange tint to the urine. Diagnostic evaluation of liver cirrhosis. Physical examination. A chronic liver is bumpy and irregular instead of smooth. Blood test, liver function test, CT, endoscopy, ultrasound, biopsy. So we can diagnose the liver cirrhosis by these methods. Management of liver cirrhosis. First is supportive treatment, eating a nutritious diet, avoid alcohol and other substances, and in medical treatment, diuretics, oral antibiotics may be prescribed to prevent infection, beta blockers or nitrate or portal hypertension, lactulose for cleansing the bowel, interferon. So these we can give in medical management, and these are supportive management. Surgical management, liver transplantation. So complications arise to liver cirrhosis: edema, ascites, bruising and bleeding, portal hypertension, esophageal varices, splenomegaly, jaundice, hepatic encephalopathy, insulin resistance, and type 2 diabetes, liver cancer. So these are some complications of liver cirrhosis.